Hello, everyone, and thank you so much for joining us today for Unraveling Medicare, hosted by Planning Alternatives. My name is Stacy Gomez. I am a wealth advisor here at Planning Alternatives, and we're thrilled to have you with us as we explore the most important and often most confusing topic in retirement, and that is Medicare. So we'll leave some time after the session for Q&A, and since the session is being recorded, don't feel like you have to take detailed notes unless you want to. We'll send the recording to you after. We'll also have it posted at planningalt.com, our events page, and on our LinkedIn profile. So if you know of anyone who would benefit from the material, feel welcome to pass that along. So now I'm excited to introduce our guest speaker, Joanne Giardini-Russell. Joanne runs Giardini Medicare, an independent agency that specializes in helping people navigate the tricky transition to Medicare. She leads employer webinars, she trains organizations, and reaches over 90,000 people on TikTok with her straight talk approach to Medicare. So alongside her son Cameron, she co-hosts Transition to Medicare podcast, where she makes Medicare not only understandable, but also even a little fun. So Joanne, we're so glad to have you here. Let's just go ahead and dive in.
Thanks for tuning in today. Medicare, as Stacy said, it can be confusing. It's we try and make it simple. I will give you as much as I can in this 1 hour session, and I will leave a few minutes at the end for questions. I'll also give an email address where you can always add questions later. You can email me privately. I do speak quickly, and I'm sorry about that. It's just that there's a lot of content. To try and hit everybody's, connection to Medicare is difficult too, to just do in an hour, but I'll do the best I can. Um, who we are, Stacy, already discussed this, but we essentially just want to get across to people is that we're just an insurance agency. So people have this funny thing about Medicare agents. They, number one, don't know they exist because all we do is Medicare, right? So people are shocked to find out, like, I didn't know people like you exist. But at the end of the day, we're just an insurance agent, an agency. So we've got our agents and our service team and things like that. And we're paid by insurance companies. People think they have to pay us potentially, but we're paid just like your car insurance agent. So we like to get that across. People always ask, how do you get paid? Once we have a person as a client, we handle everything with them, helping with claims and billings and changes with the Medicare system. And I was just talking to Stacy prior to this about the massive changes this year that we're seeing. I just came out of another meeting this morning and just hearing about carriers and what they're doing in all these different states. And it's a crazy year for Medicare. So I will touch on that at the end also. Medicare is confusing. If you're turning 65, this is what your mailbox looks like. You've seen the commercials that start on TV. It gets overwhelming. So I'm going to try and keep it a little bit easy. Like I said, a lot of people tend to think they can just go learn Medicare on the internet, which I will say you can do certain things, and I'll give you lots of resources towards the end too, where you can do it as a do-it-yourselfer to some degree. But I still always encourage using an agent. Again, there's no cost to use, so why not use agents that know Medicare? You can go to medicare.gov. You can start looking around. It's a great site. Now, we use it typically as like an encyclopedia, right? We know what we're looking for our resources, so that's what makes it a resource for us. It's hard for the consumer just to come in and start learning Medicare via the website. But there's also things to be aware of, right? So there's bad information out there. This piece right here, I've had this up since 2019 and it still holds true. So this was just a piece that came out of Costco magazine, and putting it in here, I'm not saying that Costco is the end all be all to, retirement advice, Medicare advice, such and such. However, that upper box that I boxed in where it says, first, you need to enroll in Medicare when you're first eligible. In fact, you postponing it will result in a late enrollment penalty for Part B. That is incorrect. So it's just a great example of a publication that will get millions of people to read this. They do have a connection to a giant call center. They didn't check the data. I even emailed the editor at the time and they said they fact checked it. They did not, because that is not an accurate statement. So not everybody needs to enroll at age 65, which we'll go through today, but just something simple like that can really start the ball churning of just wrong information. It really causes problems out there. So what we do is we help people transition into the Medicare system. This could be First-time people at 65 years old. It could be people retiring at 72. It really covers all of those areas. So what we're doing is we're talking to people about what Medicare really is. Do you need it? And we do really focus on that. And I'll talk that through in a second. How do you get it? If you do need Medicare, and we've figured out that you do, how do you go get it? Do you go to an office? Do you make a phone call? Do you go online? How do you get it? How much is it going to cost? Everybody needs to focus on the cost. We spend a lot of time on cost. We spend a lot of time on coverage. What is it going to cover for you? How do you put all of these things together? For some people, Medicare they think it's wonderful and cheap and inexpensive and great coverage. And some people think, oh my gosh, it's it's expensive. It's not what I thought. So we go through all of that with people. Then we put everything together for you. So if you need Medicare Advantage, you need a Medicare supplement, you need drug plans, you need dental, all those things, we are putting those together, doing the applications for you. And then we're introducing you to just reality of your medical care. What ID cards do you use at the doctors for the first time? What, did you not pay with Medicare? What is the bill like? How do you decipher the claims? And there's just a lot that goes into it that people don't really think about as reality behind the scenes. And then after that, we just really hope that you just are happy, you picked well, you picked the best you could, because there's a lot of rules that can affect people with Medicare. So you do want to choose wisely up front, but you don't want to panic and be full of anxiety about this forever. So when I talk about, do I need Medicare? This came up a couple years ago. So this is a landing page we did. You're welcome to, now this will be on a recording, but on the very top, it says, do I need Medicare.com. So what happened was, it was a few years ago. I do TikTok every single day. I'm talking about Medicare on TikTok. We've got almost 100,000 people that watch that. And we work with a lot of people from there. It sounds crazy, but it works. And everybody comes in with limited character space. And it's typically, hey, I'm turning 65 in November. What do I need to do? We can't answer that question with your basic question. So what we did was create this Do I Need Medicare, very simple, .com. And then what it does is it pops up this form, a simple form, but it helps us get the data that we need to be able to answer your question. I can't just tell somebody turning 65, just like the Costco piece did, and says, well, you got to go get Medicare, or you're going to penalize. We could do that, and we could actually gain a lot of clients if we did that, because we can panic them in. And sometimes call centers will do this, or your mailbox will do this. They make you panic thinking you have to do Medicare, and then you do the wrong thing. So what we want to do is find out, do you really need it? Because a lot of people, believe it or not, coming to us don't need to do anything with Medicare. So we're asking questions are you collecting Social Security yet? If you're collecting Social Security, you're going to be automatically enrolled into Medicare. Does it mean you need to keep Medicare? No, it does not. It means you need to figure out if you need to keep Medicare. What kind of coverage do you have today? This is a huge thing. Do you have employer coverage? Are you buying your own coverage through the ACA? Do you have no coverage? Do you have Christian Health Shares? Do you have Cobra? Do you have retiree coverage? Do you have TRICARE? So you can see there's a whole bunch of things of current coverage that helps us figure out what the answer is going to be. Are you putting money into a health savings account and you're going to work for 3 more years? That's a different answer. Do you have access to retiree coverage? Are you in the process of even retiring? Is it something you need to even figure out right now? Because if you're putting money in an HSA and you have employer coverage, you don't need to do anything, as in nothing. You do not do Part A, you do not do Part B, you do nothing related to Medicare. So what happens is we get all that information, and you can see exactly why we can't answer someone just coming along and saying, hey, do I need Medicare at 65? I'm sure, you just can't do that. So what happens is you'll get an email back from me. You can share it with Stacy, the planning team over there, which is why it's kind of nice, is you get this in writing. So this is just an example of somebody that is actively contributing to a health savings account. We give you data from CMS to support what I'm saying, because a lot of people are going to tell you, oh, you're doing things wrong, you're going to get penalized forever. So we try and give you enough that you feel comfortable with the answer, and then you have that answer in writing, and then you can act accordingly going forward. Okay, so that's why we do things that way. And it's just nice to have the base point of, do I really need to do this? And if you do need to do it, then we're going to move on to discussing things like, okay, well, you do need it, so this is what it is. And just realize that Medicare is just insurance provided by the federal government. Okay, it can be like your work insurance. It can be different than your work insurance. but it's just federally funded largely. You will do some funding as you're, with copays and monthly premiums that we'll talk about the cost, but it is offered by the federal government versus offered by Blue Cross or United Healthcare and things like that. People that are eligible, those that are 65 and older, those that are disabled, and that could be on any age. We have 28-year-olds that are on disability. As long as somebody is on Social Security disability, getting those payments for 2 years with the government, they are then eligible for Medicare. But like everybody else, it doesn't necessarily mean that they need to have Medicare. That means they're offered Medicare. And then there's 2 medical conditions, end-stage renal disease and ALS, which is Lou Gehrig's. Those 2 conditions will fast track people over to the Medicare system. But generally today, we're going to be talking about 65 and older, right? Maybe 68, retiring, things like that. So when we talk about federal insurance, we just break it down to Part A and Part B. So these are the 2 components. These are really, it's your base. It's your base of everything you need to build on once you start Medicare. So it does have different components, different copays, co-insurance, daily rates, premiums, deductibles, and everything. And I want you to see that here. I don't want you to dive too deeply into this. I just want to show that under the Part A, hospital insurance is going to cover things like skilled nursing, some home health care, hospice, things like that. They have their own set, and I missed the biggest one though, the inpatient hospital stays. You go into the hospital, inpatient hospital stays are under Part A. That's your biggest cost driver there, but they have a deductible. So if a person only has original Medicare, they don't work with an agent, they don't know anything about products, they don't buy anything else, they just have Part A and they go to the hospital overnight, they're going to have a $1,676 deductible as soon as they hit the hospital bed. Okay, they're going to get a bill for that $1,676. Now, when they have other products, they're not going to pay that typically, and I'll walk you through that a little bit. But I just want you to see that it has copays, co-insurance, and all these costs. But we work with the products to kind of make these cost and co-insurance things go away. But just know that they're there for people that just have original Medicare. The base premium right now for Part B, because that part does have a premium, Part A generally has no premium for people. So you have self-funded, all of those, not all, but most of the premium for Part A comes through payroll checks. So when you look at your pay stub right now, it has a little M Care box on it. That goes to the Part A hospital fund. Part B is funded through you and then general tax revenue. So you are going to pay for Part B premiums. Most people are. People with Medicaid are not going to pay for Part B premiums, but just we're going to be talking about non-Medicaid situations here. You're going to have a base rate of $185 per month. And that rate, I will tell you, is expected to go up in January to $206.50. It's not official, but that is what the Board of Trustees has released thus far. They're usually pretty spot on. So we're going to presume it's going to be right around that 206 mark, which is a pretty healthy increase when you look at it that way. So we'll run through more of the premiums because that's not the only premium people are going to pay. Something I always want to point out for Part A, folks, is because Part A covers skilled nursing, I think many people presume that long-term care expenses are included in Medicare. We try and hit this early. So if you're 60 and trying to prep for Medicare, I'm glad we catch you at 60. We want you to talk to Stacy and the team about long-term care. Any way you're going to solve for that, how is it going to happen? You just need to think that through. I don't care if it's insurance. I don't care if it's annuities. I don't care whatever chassis gets you to the dollars or just a bank account. Basically, you need money for care. It's a very high percentage of people that need care. And this just isn't talked about. It is such a problem in our industry. We tend to get the phone calls from the 60-year-old child saying, hey, my dad's 88. He fell. He needs help with bathing. He needs caretaking. If I can't be there till 6 o'clock, we need someone to come from 2 to 6 o'clock. You're going to be hiring that. So lots of the times the family's asking us, well, who's going to pay for that? And the answer is you are going to pay for that. Again, figure out how you're going to do that. We offer short-term care, it's called. Lots of firms don't even realize there's something called short-term care. So it covers up to 1 year in care. It's pretty darn inexpensive. and it can last for really double up to 2 years, but it covers people immediately. So it's an alternative to long-term care. It's triggered on the same things, but it's a conversation that really everyone needs to have, and have it when you're 50, 55, and 60. Too many people wait till 68 and then they don't qualify, all sorts of problems. So I just really need to hammer that home because it's really becoming a bigger deal all the time. Now, Part B, if somebody has just A and B, back to the people that just have regular Medicare, meaning when I say original or traditional or regular Medicare, I'm just talking about A and B. Okay, again, your baseline A and B stuff with the federal government. There's no cap. Okay, there is no cap to Part B expenses. So we have met people. I remember a woman a few years ago, she had cancer. She lived in Maryland. She was hitting about $50,000 out of pocket because she had a cancer diagnosis, and she refused to have a Medicare Advantage plan, which could have capped her expenses at $5,000. The problem is in Maryland, it's a horrible state for Medicare Advantage. Her doctors didn't take the plan, so she had different issues. So she was stuck paying $50,000 at that point for surgeries related to cancer. It can happen. Okay, so always get either a supplement or a Medicare Advantage plan to cap that exposure when possible. Original Medicare is not going to cover certain things. So this is bad news to a lot of people. They're used to having dental coverage through work. They're used to having some of these things covered. And they're appalled that, oh my gosh, Medicare is really not going to cover 3 implants in my mouth and I have to pay $15,000. Okay, it's not going to cover dental. It's not going to cover vision. And I mean classic eyeglasses, cataracts. It is going to cover, make it really clear, it will cover glaucoma, cataract surgery, eye issues, macular degeneration, injections into your eye, things like that, that those are medical. Okay, they're just not going to cover a classic eye exam that you can get at Costco for $50. Hearing aids are not covered by Medicare. Those have come down dramatically in price over the last few years. So that's a good thing. It's not going to cover fitness benefits. You can get them with lots of plans. The other thing it's not going to cover by itself naturally is prescription medication. So you could get, of course, prescription plans, and all of these things you can get coverage for. It's just going to potentially be extra cost. So this is super common as well. And I go back to that Costco piece again. A lot of times you're getting advice or seeking advice from the wrong places, right? Family, friends, they read that Costco piece, they tell you the wrong information. I lived through this. My husband is 68 years old. He's on Medicare. He goes to the golf course. He's mostly retired now. And he's constantly calling with friends that have questions about Medicare. And I can hear them chattering in the background, giving wrong advice. So I have to, hey, tell Tom to stop talking about this because he just told him the wrong thing. So it happens all the time. We know the guys that used to go away on trips and talk about different things, they're talking about Medicare plans now. I've been in restaurants overhearing conversations about IRMA and all sorts of things. So it happens all the time. Social Security can also give you bad advice. Remember that their job is only to sign you up for Medicare. Okay, so their job is not to give advice. I remember a woman years ago that was really angry that Social Security did not tell her to go get a drug plan. That's not their job. They don't care if you get a drug plan. Social Security Administration, as a government entity, doesn't care if you get a drug plan. It's for you to know that you need a drug plan. It's backwards, but that is how it works. Doctors don't know Medicare just because they're doctors. They're smart with medical things. They're not smart with insurance. And any doctor client of ours will tell you that they agree with that. They don't know insurance. Okay. Planners, the smart planners do exactly what we're doing today. They just bring us in because they don't know all this stuff. We spend 12 hours a day working in Medicare. They don't, and they don't want to. Okay. So we don't want their job. They don't want our job. Whoops, sorry about that. CPAs, all those HRs, things like that. It's just, that's it. It just, it's those staying in your lane kind of situations. Okay, so when people are eligible now for Medicare, here's some common situations we'll talk through. You might see yourself in some of these situations. You might be eligible for retiree coverage. You have find out, are you a teacher? I did a webinar last night for a credit union, and somebody emailed after that they are on the teacher plan for state of Michigan. Well, if you're on the teacher plan, this is my answer, is like you need to ask the ORS, which is the Office for Teachers and School Teachers in Michigan. They manage the healthcare. We don't do that. Okay. So the fact that we don't do it means we can't answer questions. Okay. So there's certain people we can't help. We can't help UAW hourly folks because we don't handle that program. We don't handle federal programs. So there's definitely a subset of people we can't even help with Medicare, and that's okay. We've got our hands full with millions of other people that are just actively working for Ford Motor Company, but they're salaried, right? So those people, when they retire, they don't have health care. So they need to find insurance on their own. So those are the people that we're working with all the time. We also have a lot of people that work for small employers. Now, small employers with Medicare is very different than large employers, which is over 20 people. With a small employer, if you work for a small employer, you need to go get Medicare at age 65. You have to go get Part A and Part B. The over 20 situation does not have to go get Medicare. It's a do you need it situation, but small employer is different. With a small employer, as soon as you go to Medicare eligibility age at 65, the small employer insurance becomes secondary to Medicare. You need to have your Medicare in place. We had a recent situation where, I'll try and make it quick, a guy in down south, nobody told him that. And we talked to him, on June 3rd or so, and said, just check, just literally go check with the employer and the insurance folks and just say, hey, if I had a heart attack, what happens to am I treated with 100% of my claim as I presume I am? And he'd asked the question, they told him the opposite. They said no. So he said, oh my gosh, I got to go get Medicare. He ran off. He got Medicare backdated to June 1st, thankfully, because he had a heart attack on June 13th. He literally had a heart attack a week and a half after we were talking to him. So he was protected because he had run off to get Medicare Part B at that time. So he wouldn't have known that. But small employers, you have to do that because it's primary coverage. They will bill you 80% of that claim. And that would have happened to him. People with ACA coverage, marketplace coverage, they need to go get Medicare. They just have to go get Medicare, okay? Because they can't stay on ACA coverage. You don't get subsidies. Your credits will expire. You'll have tax issues, all sorts of things. So just go to Medicare. COBRA is much like the under 20 employer space. With COBRA, you need Medicare as primary. So again, same situation. If he's eligible for Medicare, he had a heart attack, COBRA is only obligated to pay 20%, not 80%. So that's not good. You have a major event, you're 80% on the hook. So people that only have A and B, same thing for them. They should really go get that supplement like I talked about. So these are the situations, and this kind of connects back to the form we give people, like, okay, tell us what your situation is, and then we can advise you as to what to do. So if the person is, hey, I'm marketplace, we know the answer is, okay, you need Medicare coverage. So let's go back to employer coverage, just because there's so many things with employers, or so many people, I should say, that work past 65. So these are the key questions that you want to think about. And we have a whole on-demand webinar I'll show you in a second that you can go. It'll spend 45 minutes talking about this because so many people are, hey, I'm still working at 65. What do I need to do? So we just created the webinar that's just expressly for that question for large. This is for large employers as well, not for small, but for large employers. If you're actively working, just know you're not going to get that Part B penalty. So again, back to the Costco piece who says everyone's getting that penalty. That's not true. You will not get the penalty if you're still working. If you're on employer coverage, whether it's under or over 20, doesn't even matter. No one's getting the penalty. But to be able to leave the employer coverage, maybe Medicare is better for you, but what if your spouse is on the plan, right? What if you've got adult dependent kids? You want to look at how much you're paying, what's your health like. The costs are getting more expensive with employer plans too. I was just talking to a group broker friend yesterday who told me that, it's another year of 15 to 20% increases for the employer. The employers are not always assuming all that cost. They are passing it on to the person who's on the plan. Deductibles are more, copays are more, everything is more. So we also work in the field of ancillary cancer indemnity plans, short-term care, all that kind of stuff. People can buy those while they're still working. So you do not have to wait till you're 65 years old. You can buy them and pair it up with your work plan to just buffer some of those costs. So it's just there's just a lot of cost shifting down to the consumer. And you're going to hear me say that pretty consistently through that. This is where our on-demand webinar is for the over 20 folks. Again, it's just its own separate thing. Obviously, I can't spend 45 more minutes talking about that, but I just want you to know it's available. So again, let's go back to the person that, okay, they need Medicare. So your first step, like I said earlier, is you got to get A and B in place. These are your two components to get original Medicare. So you need to get that set up. You get it set up through the Social Security Administration. Then we talk about the cost. And this is always kind of a surprise for people. And I think people really presume it's more subsidized or more free than it really is. Here's the cost schedule. This is for somebody coming into Medicare this year in 2025. Now, what happens is the government looks at your income from 2 years ago. So they're going to look at your federal tax return from 2023, and that's how they're going to find out how much premium you and your spouse or you yourself is going to pay for Medicare. So you can see it is banded by income brackets. It's modified adjusted gross income. Okay, so we're not CPAs. We don't tell you what that number is. I'm just showing you the charts. But I will tell you, a couple days ago, we had someone from California that had a bunch of municipal bonds, a whole bunch. And he told us that his joint tax return was under 212. So he said, I'm getting hit with all this IRMA, this giant charge. And I said, well, you said your income's under 212, and it is and was on his tax return in 23. He said, but I have a whole bunch of bonds, municipal bonds. So that does affect IRMA. So he has to pay, he's in the more the rate of down here, the 591 IRMA. We thought he was 185 based on what he told us. He's really down here. So just know municipal bonds is something that kind of surprises people, but they look at your modified adjusted gross income and then they just assess your number. Okay. So if you've got a common question here is this per person or is this per household? It's per person per month. So the numbers you're seeing on the right-hand side are per person per month. Okay. So they're higher than a lot of you expect. The other thing that happens here is people, when they retire, they say, well, I don't have that, money anymore. I was making a paycheck of 300,000. Now I'm going to live off of 150,000 because that's what Planning Alternatives suggests we do, et cetera, et cetera. I get that. So what happens is you've got another piece. There's two. Let's back up for a second. We've got two parts of IRMA. This is called, it's an income related monthly adjusted amount. That's IRMA. So IRMA just means surcharge. IRMA means an extra tax or surcharge for you, for higher income folks, not higher net worth, but higher income. So again, let's just say you made 300,000 and you're looking at this like, oh my gosh, I have to pay $35 a month extra on my drug plan side of things, and I have to pay $370 a month now for Medicare versus $185. That's not fair. I don't have my paycheck anymore. So what happens is you fill out this form. This form is super important. It's an SSA 44 form. You can just Google it to find it. We can provide it to you. We have a whole IRMA calculator website we can give to people, but this is where you put just your name, your social, and you pick your life event basically and just say, hey, I stopped working. So in this case, the person picks work stoppage. You put the month and the date that it kind of happened. Like I retired May 1st, 2025. And then you put in the reduction of income in step 2 and then further in step 3. So if you're showing your income will be reduced by your work stoppage, you just write it in there. This is not an official tax return. It's just you stating on the line. If you're wrong, don't worry much about it. They will find it later and adjust things backwards. But you're just putting in, just saying, hey, I was making 300. Now I'm at 160. And then you can even say, okay, in 2026, I expect it to be 120. Whatever number keeps you under that 207 or 206 threshold, 212 threshold. Okay, so then what happens is they reduce your premium in that case to $185. And then going forward, they reassess it. So every year, you're going to get a letter from Medicare saying, hey, this is what your premium is going to be in 2026. And what they're looking at is your 2024 income. So there's a good chance as you retire that you're going to be going through that process a couple of times with that SSA 44 form. Okay, so again, that's something we help the clients with. And again, some of this stuff is exactly showing you why it's kind of nice to have the Medicare coaching help. So then you've got enrollment times. You've got an initial enrollment period, you've got a special enrollment period, and a general one. The only ones we're going to talk about are the initial one, which is basically, hey, you're turning 65 in November. You can sign up for Medicare now, and you can sign up for Medicare in December, January, and February in the case of a November birthday. All it's saying is, hey, if you need Medicare, this is your time to do it, okay? No questions asked, just fill out a simple form and you get it, right? As long as you qualify for it. The second time, let's say you go through that, and you're like, I don't need it right now because I am working at Ford Motor Company. I'm a salaried person. I'm staying on till I'm 67. Then they're going to retire. So in this case, they're a special enrollment period. Now, in this case, they do need a form because what happens is if you come to the government at age 67 and say, hey, I want Medicare, they're going to say, well, show us proof that you've had prior insurance back to age 65. And if you did, we'll give you Medicare now. And if not, we're going to make you wait until certain times of the year kind of penalty, and then that's the penalty situation. So if somebody can't prove that they've had coverage for 2 years in this situation right here for a 67-year-old, if they had no coverage for 2 years, that is the time they will get the late enrollment penalty. But our person that's working is not going to get it because they're going to take the form to the HR department at Ford. They're going to sign off just saying, yes, Joe has had coverage with Ford since he was 65 years old. And then that form goes with Joe with his application to the Social Security Administration, and then they process it. And you're processed with no penalty. You get to pick your start date. So right now, we are working with lots of people that are retiring December 31st and need coverage January 1. So the form is saying, I need coverage January 1st. Okay, here's my proof. I want January 1st coverage. And then we are working with them on the other side of the things that we need for Medicare. Okay, so that's the overall process. It's not difficult. If you have a spouse, you get the same thing. If this person is married to a 66-year-old who doesn't work at Ford but is on their insurance, they get an L564 also. And then 2 forms go into Social Security as they're both applying for Medicare. Okay, so again, that's kind of stuff we go through as the overview. All of that stuff I just described is stuff that we just do. And we're not agents for that kind of stuff. We don't work for the government, just to be really clear. We don't work for Social Security. We don't work for Medicare. We work with insurance companies giving the consumer insurance products. And this right here is kind of where we flip and turn the switch over to being agents, because we're looking at original Medicare. This is from the Medicare New Handbook. I love the simplicity of this slide just because and this is in the handbook on page 10. You've got your original Medicare in place. So again, remember always that you have to have A and B in place to do anything that we're talking about next. Have to have A and B. You can retain only A and B if you want, which is not wise, as I mentioned, because it's uncapped. You've got a whole bunch of issues there, but you can do that, right? But it's showing on the left-hand side of this page that original Medicare, the nice part to original Medicare is the freedom. And that's where I highlighted it. You can use any doctor or hospital that takes Medicare anywhere in the United States. People love the simplicity and freedom that original Medicare brings them. They can, if you look on the very bottom, it says you can also add a supplemental plan, which is a Medicare supplement or a Medigap plan, we call them. Both are the same things. I guess different words for same product. That's what we give people. When we enroll people into Medicare supplements, we're paid by the insurance company, but we're giving you the supplement to your original Medicare. We are rounding out the cost. We want your 20% coinsurance to go away. That's why we're putting the supplement in place. It says you can also add a drug plan. You should always add a drug plan, even though you just can. It's optional. You're going to get a penalty if you don't. So we walk you through that piece too. That's pretty much it on the left side. Again, it's rather simple and straightforward. You go to any doctor you want, you've got a supplement to pay the rest of your bills. That's it. On the right-hand side, some of the confusion starts with Medicare Advantage. So Medicare Advantage, sometimes people call it Part C of Medicare, though it's technically not a true part of Medicare. And you just got to be careful. Just look at the words, okay? Medicare Advantage is a private company such as a Blue Cross, a United Healthcare, an Aetna, a HAP, Priority Health, all those companies. They offer you an alternative to original Medicare for your health and drug coverage. It's an alternative. So people that, even though you're paying that Part B premium, this is what confuses people. Even though they're paying that premium, they have insurance with Priority Health, for example. Priority Health is their alternative to their coverage. Okay, Priority Health is the one that will be managing their coverage, not the government. Okay, Priority Health is offering this bundled program that's usually offering all the things that A and B cover, and usually drug plans, things like that. In many cases, you may need to get approval from Priority Health before it covers certain drugs or services. That's called prior authorization. Plans often have different out-of-pocket costs than original Medicare versus original Medicare and the supplement. Okay, so that is very true. So the schedules for this Priority Health plan, as my example, are very different. You might go into the hospital for one night and pay $350, not $1,600 like you did on the other side. Okay, so it all depends on your plan. Some plans have extra benefits that original Medicare doesn't offer, but always remember that your control, your managed care person is the insurance company. Okay, you don't have that on the other side with original Medicare and your supplement. Your supplement is there just to pay the bills. So this is trying to give real life examples. Our middle column here is what top of the line Cadillac Plan G is called. So Medigap Plan G is the current Cadillac. In our area of Detroit, roughly it's about $150 a month. So they pay a flat fee. So every single month, this person pays the $150 to the insurance company. They have a deductible this year of $257. That will go up January 1st. We're thinking around 288, but we're not sure also, but 257. Okay. Once the person satisfies the deductible with a Plan G as their supplement, they pay nothing. So regardless of what happens to their body, they get cancer, they have 30 sessions of physical therapy, they get chemo radiation, they get hospitalized for 6 weeks, they have to go to the doctors constantly, things like that. Physical therapy, craziness. 0, 0, 0, 0, 0. They're paying the flat fee to cover all those things. Okay. As long as Medicare is paying and approving a charge, the supplement steps up to pay the rest of your bills. They don't get involved in your world. You never have to check with them, say, hey, Mr. Physical Therapy provider, do you take United Healthcare? Okay. It's just there to pay your bills. However, there is no dental coverage involved. There's no vision coverage involved. And you do have to get a separate drug plan. And that's going to depend, the cost will depend on what medications you take. Other side, right-hand side again, Part B. I'm sorry, you pay the Part B premium in both cases. So just remember that regardless of what you do, you're still paying the 185 or more with the Advantage plan, which again, it could be your HAP, your PPOs, your HMOs, all those, Blue Cross, all of those. They could be 0 per month of premium. So instead of paying that flat 150, maybe you're paying 0. 70% of plans have a 0 premium. Okay. Maybe you have no deductible. Maybe you have a $300 deductible. Who knows? Everything is going to vary based on the plan. You do have a max out of pocket. So that is one of the good things about an Advantage plan is that they give that max out of pocket so that if you have a bad year, you're capped. The annual level is 9,350 in terms of a cap. It's more like 4,000 and 5,000 in our area for most plans. You're going to have, this is where it looks a lot like your current insurance at work per se, right? How much is it to go to your primary care doctor? How much is, a specialist or all these things going to cost you? It's all copays, right? Hospitalization is going to be days 1 through 5, 1 through 3, 1 through 7. Again, everything varies. Can't quote these things. It could be 300 a day, it could be 450 a day. It depends. It's going to be a hospital charge per night. Chemo radiation, we put this on here because that's a big expense. If somebody chooses a Medicare Advantage plan, then they get cancer, and then they need chemo radiation, they're hitting their max out of pocket. They just are. Skilled nursing. Medicare pays the first 20 days, but days 21 through 100 on an Advantage plan, they're going to charge you $200-$300 copays. Okay. With a Medigap plan, it's 100% paid for the full 100 days. Physical therapy is a per charge visit. You might have $20, $50, $80, who knows. Dental, very often some dental component might be thrown in there. Some vision component might be thrown in there. Everything is very, very plan specific. Nothing is generic with any of the Advantage plans. Premiums are typically built into the Advantage plan as well for drug plans. It does not mean your drugs are free though. So people, even though it's 0 premium for the drug coverage, do not presume that it is free medication. Okay, people confuse that. The reason why, and this is the most important thing, if you can take away one thing today, it's super important to know what your choices are because of something right here called the Medigap open enrollment period of time. This is a one-time thing in everybody's life with Medicare. And this is where it differs from employer insurance or ACA coverage, things like that. In those coverages, you really can't hurt yourself. In Medicare, you can hurt yourself. So when people are solicited constantly by call centers in your mailbox for HMO, PPO plans for Medicare Advantage, it is heavily pushed by the government, by both sides of the aisle. So it's not a political thing here at all. The government would prefer you all have Medicare Advantage because they don't have to deal with your claims. They don't have to pay for you directly. So they would prefer everybody go to Medicare Advantage. And it makes it very enticing. That's why call centers, that's why people push, if you will, Medicare Advantage plans. If you don't realize that the supplement is another option, everybody has this one-time enrollment period where as you turn 65 or are older, let's say you're retiring at 70 years old. If you're just starting your Medicare Part B at 70 or 65 when you turn 65, that's fine. Either situation, you get a 6-month window to pick anything you want. And this means that you can go to, if you have cancer turning 65 years old and you go to an insurance company and you have cancer, you're not going to be turned down for pre-existing conditions. Okay, you have 6 months to go get anything you want. The problem that many people make is they go right to Medicare Advantage because they're healthy, everything's great. 4 years later, they come and they say, hey, now something happened. I want to upgrade my coverage. I want that supplement thing I remember hearing about. You can and will be denied. Okay, your pre-existing conditions will come into play. Someone today, we just got a denial from an Illinois person that tried to change insurance companies. So it also applies to changing companies down the road. He already has a Medicare plan. He was trying to do a price improvement. He was declined. We don't know why he's declined. He's going to get a letter, but he was declined. So it happens. So you just need to know about this. And this is why so many people get tricked essentially because they just don't even know a supplement exists because you'll never see commercials. I take that back. I saw a commercial recently for Physicians Mutual, which was advertising a supplement. And I perked up because I heard it. I was shocked. Rarely will you see commercials for Medicare supplements. You'll see them all the time for HAP, PPOs. Humana is big on the commercial time in the fall, things like that. You just need to know the rules of Medicare because, like I said, you can get hurt by Medicare. Okay. So when you decide, if people decide on a Medigap plan, we have really, there's three now. We need to revise this slide because Plan G is the Cadillac, Plan N is a little stair step down, still a great plan. And there's a new one we've been talking a lot more about that people have actually been interested in. It's a high deductible. So instead of having a $257 deductible, it's a $2,870 deductible. So people are willing in some cases to take on that $2,870, and that's going to increase as well. But it increases connected to the cost of inflation, the CPI. So it does actually go up pretty slowly. I think it's a great option because what we've been doing is pairing those plans because they're just a lot cheaper. They could be $40 a month versus $150. And then you can just, get a cancer plan or get some of the basic stuff that really reduce your risk. So I like that as a package. So it's been interesting. So we need to change that. I think just because the ratcheting up of cost over the last couple of years, people are finally looking at the high deductible. So these are just some thoughts heading into 2026. And if you're on Medicare, you'll maybe have questions about this, but prices are increasing. Like I said, this is year number 2 of getting hit pretty hard. Again, coming out of this meeting I was on earlier, PPOs. So PPOs are really getting hammered by the insurance companies. So you've seen maybe headlines. So United Healthcare, 600,000 people are losing their PPO plans, mostly PPOs, I should say. A lot of people are losing their plans. Over 1 million people this year will get a letter this month. We've started to hearing from people that, hey, I lost my plan. So their plan is going to end December 31st. What that means is they have to get a new plan January 1st, or they do have the ability to get a Medicare supplement without underwriting because they lost their plan by no means of their own. So it'll be an opportunity for some. It's just going to be crazy for the industry. We've got a lot of insurance companies paying agents like us zero, like literally paying us zero for certain plans because what they do is if they don't want that product sold, they just reduce the compensation to zero. It's usually an indicator that the plan is not going to be good for the consumer ultimately because they're cutting costs. They're just cutting. They're cutting benefits. And this is a year we're really seeing that. This industry swings wildly. It was interesting that just 2 years ago, Aetna had plans that literally were paying for people's golf green fees. They were paying for pickleball rackets. They were paying for ski passes, park passes, for people. They were paying for tennis shoes, for walking. So you had a company like that giving massive amount. It was like $1,800 a year they would pay for those things, which was crazy, right? So it wasn't medical coverage. It was just what perks. And now that stuff is all gone, simply 2 years later. So this is a year where we're seeing more focus on all those little gizmos are gone, and you're focusing on, hey, does my doctor take the plan, and are my drugs covered? Which is really what it should be, but it really got lost for a number of years. It got crazy. So you had consumers chasing the freebies and then realizing their doctor didn't take the plan, or call centers just catching people and they don't check the doctors, they don't check the medications. It's crazy, but it was kind of the Wild West. So we're swinging back to the center, but also a lot of cost went into that. So now we're seeing pricing and all that kind of stuff going on in the industry. So it's not a good place to be this year. Even we have things like there was a cap on prescription drugs. Um, some of the outcome from the cap on prescription had people, really loading up on those GLP-1s, the Wegovy's, all those things that are super expensive. So that swelled cost. So a lot of reasoning has gone into a lot of cost, usage, utilization, all sorts of things. But all of this does affect you, right? Because you've got agents that aren't getting paid. So, we show plans that are available, but if it's a plan we can't get paid on, we can't take the time to do the work. We have to tell you how to go do that. And then you just don't have an agent. So it stinks for the consumer, stinks for the agent, but we can't take 2-3 hours to work for free. It's not a way we can operate. So there's a lot of shifting of a lot of things to the consumer. And that's why we're always talking about even the additional products, just kind of consider those while you can and while you're younger and healthier to lock in those pricing, because it's just healthcare is just not a good scene these days. Okay. Just a quick recap on Medigap. I just want to give you the quick overview in my mind. It's easy. It's very simple. If you're a, you know, a snowbird, right? You go back and forth. You just easy. People always say, we like eat. We don't want paperwork. Don't want stuff. Medicap's for you. Great. You got to be willing to pay for it because you have to be okay with the higher premium. And it does get costly as time goes on. Medicare Advantage, a zero on the surface. If you're healthy, fantastic. It's super affordable, right? It's really easy. There's lots of people that are okay with networks, or they say like, hey, I've had this stuff with my workplace for years. I'm used to it. That's fine. I'll just take that. Veterans are a fantastic group where they don't have to get Part A and Part B of Medicare, but they absolutely should, because if they want to come outside of the VA, because you can have problems with the VA, it might be great for a couple of years and then all of a sudden it's horrible. So if you want a second opinion, things like that. So if you know any veterans, make sure they're getting at least Part B, and then get an advantage plan. Some of them are built just for VA, and they're great, programs. Drugs. So we'll talk about drugs kind of quickly, but there's a penalty if you don't enroll. So going back to that Social Security, someone didn't tell me, I signed up, they didn't tell me I need a drug plan. It doesn't matter. They don't need to tell you, they're not going to tell you. But if you don't, and a lot of people screw this up, this is where the penalties are, they do come in play. So people really don't get the Part B penalty much. They get the drug plan penalty a lot because, hey, I'm 65, I don't take any medications, I'm good. Okay. If you're diagnosed midsummer and with something like you need Eliquis, you don't have a drug plan in place, you're going to pay a lot for those drugs. Okay. Part D pricing is going to change and effective October 1st. This is when all of it hits the fan in terms of Medicare.gov. You can see the new pricing. You'll be able to check your drug plans. We always give a video out on October 1st on exactly how to do this. Okay, we teach our consumers how to do it. Everybody needs to check their drug plan every single year. It takes 10-15 minutes. It's really easy to do. All right. Here's some resources. You can just take a screenshot or just look at some of these places if you don't know about them. Great places as alternatives. You don't have to always use your Part D plan, but you always need to have one in place. Here's the Inflation Reduction Act, some of the outcomes. So in 2026, we will have a $2,100 out-of-pocket cap. Like we had a $2,000 this year, 2025. Great for some people because some people were spending $8,000 to $10,000, right? And now they're spending $2,000, which you can see when people start only spending the $2,000 in that situation, they didn't care if it was brand or generic or whatever. It's just like, whatever, I'm capped, right, at my $2,000. So you can see where the cost then exploded on certain items. So it's hard to get this stuff perfect, as you can see. So anyway, 2,100 in 2026. This is a list of drugs that have been negotiated with the government for pricing. So these have come down in price. We will have to see October 1st how it plays out individually. So you'll hopefully get some price breaks in some of these pricey ones. So these are the first 10 that were negotiated. They're doing a new 10 every year, and they keep releasing those over the years. So quickly, just to recap, then I'll show you resources and answer some questions for you. But know when or when not to enroll into Medicare. Please, 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 please. Work with an agent just because we can give you a lot of value there. If you're retiring, start 4 months prior to your coverage being needed. So our January 1s we're working with right now, we've been working with those folks even from August onward. Just get ready, get the overview, know what your timing is, go do your homework, and then get your time to get your Medigap Medicare Advantage plans in place, understand how those plans work, understand how they're different from one another, and choose accordingly. Okay, don't always presume that you can make a change. and then protect yourself from the prices and all the things that are, going through the system. So that's with, cancer plan, short-term care, et cetera, things that aren't covered that will be a big gap in coverage for you. Okay. Timing of things, October 15th to December 7th is our really crazy time because that's when people can make the change of the drug plans, of the Advantage plans. January, February, March is another window where we can do things with Medicare Advantage. You can't do anything with drug plans during those months, though. So those 3 months, do not expect to fix problems with your drug plan. You have a one-time shot, October, November, December for the drug plan. So you've got to get it done during that window. Medicare supplements, if people want to change, like our guy yesterday that got declined, he tried to change, but you can see in September he's able to do that. Those are all the time. People assume it's just tied into October. It's not. So do those prior to the crazy time. Talking about Medicare before you turn 65 is key, just so you can avoid mistakes. Okay. Don't be the person that calls us and say, hey, my brother-in-law told me to do this and I did it. And then we tell him he's wrong because he shouldn't have done that. And he has to try and unwind. It's a nightmare. Okay. You're going back to the government trying to unwind things. Easily can be avoided with, hey, I'm turning 65. What do I have to do? Filling out our form. So many things can be avoided just by a quick phone call. This is where we kind of hide all of our resources. If you go to this MedicareLaunchpad.com, it basically brings up all of our stuff, which I'll show you is Facebook, I think is a great resource. We have a private Facebook group. You just search that, basically search Giardini Medicare, will pop up on there. We answer questions all the time. We post documents. We put things about the SSA 44. We link the forms. We have videos in there. We've got all sorts of things, calculators we release, things like that. So you can always go back and see what other people are asking, which is nice. So you don't have to hunt for it, but it's a great way to get information. We have a ton on YouTube. So YouTube is where we have all the videos of completing the plans and, IRMA ones and just everything related to both supplement and Medicare Advantage. And we have a course, you can go into the course. We think we've identified every learning style essentially. So here we've got the TikTok and YouTube. We've got the podcast. We've got a live webinar. We do webinars twice a year. So I think, like I said, we've really hit where everyone has a way to learn Medicare. I will warn you once more, I don't consider Medicare a do-it-yourself project. I know Planning Alternatives does not either. But we live in this world, right? We try and explain things. We help you avoid costs and issues. You can do it yourself, but that's what I love about our resources. You can go investigate YouTube. And not even just our channel. We've got friends in the industry with fantastic channels. Go look at all of them, but then find your person, who it is to guide you through stuff. If we don't work in your state, we've got lots of connections, partners across the country that can actually help. People schedule phone calls with us on our website is one way to reach us. And I'll answer questions next, but I want to show you the map of the states we we work in green. And there is a phone number in the right side, which is Trina and Dawn generally handle scheduling. So you can call people, you can go online to our website, which is in the middle, and that's how you schedule appointments. Okay. But these are the states we work in, and they're listed below. The info@gmedicareteam.com, that's, like I said, that email will come just to me, so I will answer your questions. So if you have something that you don't want to share publicly, because I'll take the last few minutes, we have 7 minutes left. I'll wrap up with any questions you want me to answer. You can actually put those in the chat section, or I don't know, Stacy, if you want to take people off of mute, but I will answer questions. But you can always email me. Okay, get lots of emails following these presentations. Okay, so that's it, Stacy.
Thank you so much. That was a wealth of knowledge. And if anyone does have a question, you can type that into the Q&A button, which is at typically the bottom of your screen. And I'll see that pop up on my end. But while we're waiting for people to do that, Joanne, just curious, do you have a resource for someone who lives in a state that you do not cover?
We do. We have a great
Okay.
resource, and they cover all 50 states. So what happens is I have a referral form that I would email the person. So email me for that. They fill out a
Okay.
form, or I connect them with Charlie and his agency. They're located in Missouri, and they cover all 50 states. And we've referred to them for about 5 years now, and thousands of people. It's been great. We have to do that,
Perfect.
especially with TikTok and YouTube, because we get a national audience there.
Okay, wonderful. Thank you. And I just had a great question come in. How do you charge for your services?
We don't. So that's the thing people don't. They just are shocked. We are paid by the insurance company. So again, if you're getting an Advantage plan with Priority Health pays us. If you're buying a supplement with United Healthcare, they pay us. So we're paid for those things that we give you. So just think of it like your car insurance. You don't pay your car insurance agent a check for a couple $100. It's in the product. Ours is the same way. And the price
Okay.
is the same. I should mention too, the pricing is the same. So whether you go directly to the insurance company, you're not going to get much help from the insurance company. You will from the agent, but not the company, but the price is the same for you. So it really doesn't make sense to go directly to the insurance company.
Okay. Thank you. And then where is the link to the webinar for people still working at 65?
That is the over 60 web. It's a website. It's called over 60 web. I'm sorry, over 20 Medicare.com. So it's its own website. So just go there and you'll have access to the video.
Okay. So over20medicare.com. Perfect.
Right.
Thank you. So we're getting kudos for the webinar. Thank you again, Joanne. Fantastic information. The question is, can someone give out your contact information? And I think it's safe to say definitely yes. And from a
Yes.
kind of financial advising perspective, I'm one of many
Mhm.
financial advisors on the team at Planning Alternatives. So feel welcome to pass out our information as well.
Yes.
Okay, we just have a few more minutes. Let me see if there are any other questions. What about an HSA? I think you mentioned there's going to be a
Mhm.
new high deductible Medigap plan. So can you
There is a high
continue to
deductible plan.
contribute?
No. So the high deductible plan doesn't mean anything related to HSAs. It just means that they have a high deductible for their coverage kicking in. So instead of a 257 deductible, it's 2,800 roughly, but it doesn't have any connection to the HSA. And right now, there's been some so when they did the big beautiful bill in July, they were trying to make it that people that enrolled in Part A were able to go and get Part A, but also contribute to the health savings account. That did not come come through. Okay, that is not in the final bill that was signed. We've even seen some financial firms had to redact what they said. We've seen it all over social media. We've seen wrong videos because people are saying, oh, you can just go get Medicare now and you can still put money into an HSA. That's not true. So it is not part of the final bill. Nothing has changed with HSAs and Medicare. In order to contribute to and put money into your health savings account, you cannot be enrolled in Part A or Part B. So if you're
Okay.
going to work, and that's addressed in the video here, if you're going to work and you want to stay working, you want to keep funding that HSA, and I love HSAs. I have mine, I fund it to the hilt. I love it. But if you want to keep doing that and you're going to work till you're 70, for example, do not get Part A as an apple if you want to keep putting money into the HSA.
Okay. Very helpful. Thank you. Um, I think that's it then, as far as questions are concerned. Again, if you have any follow-up questions or want to discuss Medicare in general, can certainly reach out to Joanne. You can always reach out to your advisor as well. So I want to thank you again for joining us today.